Dr. Muhammad Munir. He's a virologist at Lancaster University. Thank you so much for joining us on the program. Now, we heard that Chinese officials are confident the outbreak will be over soon. Is it because they're now collecting blood from people who are cured from the virus?
Well, if we look on the beginning of this outbreak, Chinese government have put certainly very nice control measures which have helped really to stop the spread of the infection, not only within China but also overseas. But in last 3 days, the situation has changed. We have seen an exponential number of the cases and also the mortality, and overall panic in the China is peaking by sort of sacking the medical officials and also providing statements which are contradictory. So based on all of these observations, it seems like the situation is slipping out of the hand of China, and it would, if it continue, I think the situation would be a little more gruesome for the rest of the world.
Now, we heard about the first death in Europe from the coronavirus, and now we know of the first case in North Africa and Egypt. Is the WHO going to take any measures to help officials contain the virus there before it spreads furthermore?
Well, WHO has been doing whatever it can do right from the beginning, especially after the announcement of public health emergency of international concern. But really, the major thing that is contributing now into the further spread of this infection is a lack of infrastructure in many thin economies. And as we started seeing, the cases are further, spreading in Africa, starting from Egypt. And if this trend continue, I think that would be one of the major concern for this moment. And a lot more resources need to be mobilized, not only with the emphasis of WHO, but also international thick economies, so that all the control measures required to contain further spread can be applied. But without this concrete consensus and the global effort, we can't claim that the virus would be stopped by further spreading.
Mm-hmm. Now, there are a lot of misconceptions when it comes to this virus and how lethal it is. Most of the people that we see pass away from the virus seem to have already had illnesses or are old in age. Isn't that the case?
Well, that is true. Majority of the mortalities and the deaths we have seen so far are in people who have underlying causes. But that is one side of the story. Another important aspect that we need to consider in this whole scenario is that within just 1.5 months, this COVID 2019 new coronavirus has caused double than the mortalities in SARS coronavirus, which occurred in 2003 for 1.5 years. So the overall impact of this virus is equivalent to 1.5 years that we have seen in 1.5 months. So this virus, in terms of mortality, appeared to be more devastating than what it has been in SARS. But we do understand the underlying causes are contributing quite significantly into the mortality. But that is a secondary one. Major cause of the mortality has been with this virus.
All right. Thank you for that analysis. We appreciate it, Dr. Muhammad Munir.